Hello, I'm Dr. Rushikesh Thakur, interventional cardiologist at Navi Mumbai and Panvel. Today we are going to discuss latest update in hypertension. As per WHO, nearly 63% of total death in India are due to non-communicable disease, of which 27% are attributed to cardiovascular disease, which affect 45% people in the 40 to 69 age group. Raised blood pressure is among the most important risk factor for cardiovascular disease. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. In India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29% and 28% respectively. Despite that, nearly half of the people, or 51% of men and 41% of women with hypertension, are unaware of the condition. Additionally, over 62% of men and more than 53% of women living with hypertension did not get the treatment. Medication was used to control the blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. International Society of Hypertension has released the ISH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigm attempt to address the issue that in resource poor setting. Optimal care refer to evidence-based standard of care, and whereas essential standard refer to minimum standard of care to allow specification of essential standard of care for low resource setting. American Heart Association and American College of Cardiology has released a scientific statement in 2021 offering new guidance for management of stage 1 hypertension among patients with low atherosclerotic cardiovascular disease risk. Among low-risk adults with stage 1 hypertension, that is blood pressure between 130 to 139 systolic and 80 to 89 millimeter of mercury diastolic, management start with non-pharmacological therapy. If blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacological therapy. Acute respiratory distress syndrome is a potential fatal condition involving lung damage, and experts often associate it with severe COVID-19. A recent study, which appeared in the Journal of American College of Cardiology, reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. Lowering systolic blood pressure targets down to 110 to less than 130 millimeter of mercury range substantially reduces the cardiovascular adverse event in the STEP randomized trial, affirming the SPRINT finding for an older Chinese population. Among some 8,500 patients ages 60 to 80 in China, the intensive target trimmed 26% of composite cardiovascular risk. Finding from now a second major trial supporting a lower target could unite the guidelines, which even among US professional societies ranges from threshold of 130 to 150 millimeter of mercury. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European guidelines on the management of arterial hypertension recommend that diagnosis of hypertension should not only be dependent on office blood pressure measurement, but also on out-of-office measurement, such as ambulatory blood pressure monitoring or home blood pressure monitoring. 24 hours and nighttime blood pressure measurement were associated with greater risk of mortality and composite cardiovascular outcome. Thus, they may be considered as the most relevant measurement for estimating cardiovascular risk. For every 10 to 20 millimeter of mercury increment in blood pressure measurement at night, the risk of mortality increases by 23% and risk of cardiovascular event by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal blood pressure control. In 2018, European guidelines equally recommended 5 classes of antihypertensive drugs. Considering high non-adherence treatment, the importance of combination treatment is particularly highlighted to improve the adherence to therapy and blood pressure control. Therefore, the 2018 European guidelines recommend, especially in the context of lower blood pressure target, to start antihypertensive therapy with initial dual fixed dose combination of AC inhibitor or ARBs with calcium channel blocker or diuretic. Since July 2018, products containing valsartan have been recalled worldwide. The reason is detection of known carcinogen, namely N-nitrosodimethylamine, NMDA, which can found in candesartan, irbesartan, losartan, olmesartan, and valsartan. NMDA has been classified by WHO International Agency for Research on Cancer to be carcinogenic in human. If 1 lakh patient would have received NMDA contaminated valsartan from Zhejiang OI manufacturing site where the highest level of contaminants were found every day for 6 years in the highest dose, it could result in 22 additional liver cancer over the lifetime of these patients. The presence of NMDA in these drugs could lead to 8 additional cancers in 1 lakh patients if they had taken highest dose over 4 years. Valsartan recall accompanied by a significant increase in the rate of emergency department visit, more than 6%. The HYGEA study represents largest study tested nighttime antihypertensive therapy. In this trial, chronotherapy was associated with significant reduction in endpoint, including death. The HYGEA chronotherapy trial tested whether nighttime therapy, in comparison with usual upon awakening hypertension therapy, exert favorable cardiovascular risk reduction. The largest study in participants experienced the primary cardiovascular outcome. An ambulatory blood pressure measurement was performed for 48 hours to collect the data on how blood pressure offered during sleep. The relative risk reduction of cardiovascular events was significantly improved for nighttime treatment when compared with awakening treatment. Overall, on meta-analysis of all these studies and guidelines, we found that hypertension control towards a lower level side is much better to offer better cardiovascular risk reduction so that we can improve the outcome of the patients in antihypertensive patient therapy. Thank you.